Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. Tonight, I'd like to talk about saving your teeth. Saving your teeth is part of staying young. It's holding on to what you've got. And tonight, I'd like to talk about root canal therapy. Root canal therapy is one of the most fantastic procedures that we have for saving teeth. But let's talk a little bit about just exactly what it takes to do root canal procedures. First of all, I'd like to show your attention over to this point here. Most people who have abscessed teeth are not even aware of it. Sometimes there's pain, sometimes there's not pain. But when they go to their dentist and the dentist says, "Sir or ma'am, you have an abscessed tooth, you have swelling, you have infection, you have an abscessed tooth," your dentist will recommend that you have a root canal procedure. Now, in this first view here, we have a molar tooth, and you can see the decay in this area. This is what abscessed this tooth. Now, this part of the tooth is the living part of the tooth. But in this case, the infection has destroyed that part of the tooth. And if you'll follow our pointer all the way down here, you can see where infection has occurred in the bone. The infection is to the point that the inflammation, infection, and even sometimes pain is present. Unfortunately, if this is not treated, the infection can get to the point where a bone is lost and the prognosis or success rate is affected. So what I thought we would do this evening is actually do something that has probably never ever been done on live television before. I am actually going to do a root canal procedure right here for you to see. Oh, and by the way, this is a call-in segment. If you have a question about root canal procedures, if you are in pain, if you have been told that you need a root canal procedure, give me a call. I'd love to hear from you. So we'll go ahead and get started. I brought with me a bicuspid tooth, and I'll hold it very, very steadily here so that you all can see it at home. Now, this tooth was extracted 3 days ago. It was extracted because it was inflamed and infected. It was an abscessed tooth. So we'll go through the process of root canal therapy. First of all, an opening is made in the tooth. And as you can see right here, an opening has already been made. For realistic applications, I couldn't bring a dental drill in here, so we'll just proceed as we have right now with an open tooth. Now, an x-ray was taken of this tooth to determine just how long it is. Now, let me hold it just so that you can see. There is a working length from the very top of the tooth all the way down to the very end of the root, right here. Now, that's very important because that's what we call measurement control. And in this case, that happens to be 21 millimeters. Now, I have with me a series of instruments called endodontic files. Now, endodontic files are very much like files that we use at home. The only difference is that they are extremely fine and extremely finely and finitely calibrated. So let me go ahead and we'll go through the process of cleaning out and removing the infection and inflammation inside the tooth. We'll start with our smallest file. This file is called a size 20 file. And you can see right here, I'll hold it right here so that you can see just how exactly fine this file is. Extremely fine, extremely accurate. And you might also notice that there is a little rubber stopper on this file. That is important because that tells us exactly what our working distance is going to be inside the tooth. That way we don't go any further or any short of where we need to go. Now let me go ahead and insert this into the tooth. As the file is inserted in, we go down until we hit our working distance. As you can see, the file is now in the tooth. We rotate it and remove it. Rotate it and remove it. Now we go to our next size. We place the next size, which is a size 25 file. Again, we rotate it, remove it. Rotate it and remove it. We go through all the series of files, and again, you can see that there are a whole series of files right here, all the way from size 25 all the way up to size 50. Now, without going through all the specific files, we'll go up to our size, let's go up to about size 40. That would be about where our working distance would be. Again, we go back in, insert into the canal of the tooth, and let me position this so that you can see this properly at home, and we bring this all the way in place, and then we turn it and remove it. Now, at this point, there is a lot of debris and infectious material. What we need to do at this point is to irrigate this. Now, we use saline solution. That's most commonly referred to as salt water. Now, I'll go ahead and bring some salt water into our syringe. And here we'll go ahead and fill it right here, as you can see. And that should do very nicely. We go ahead and then irrigate the inside of the tooth. Now, as you can see, there we go. As you can see, the salt water is exuding from the inside of the tooth. This helps remove infection and debris inside the tooth and helps us clean and cleanse the tooth. Salt water is a very, very good irrigant. Now, we go back to our final size, which in this case happens to be a size 60 file. And again, we insert it back inside to the tooth. And again, very carefully, and I must stress, great care is necessary in order to do this properly. Again, we turn and then we remove. Okay? At this point, we have cleansed the inside of the tooth. Now, traditionally, what we do at this point is we place a cotton pellet, and I have one here, which is placed inside the tooth, and a seal, a temporary seal, is placed in the tooth. At this point, about 2 weeks are allowed to go by. The idea is to allow the infection to subside so that the inside of the tooth is completely antisepticized. And that's very important because our next step is to seal and finish the root canal procedure. And I understand we have a telephone call. Please go ahead.
Dr. Casebolt?
Yes.
This is Nancy Michaels. I think you just answered one of my questions about 2 weeks, but what's kind of painful, is it?
Not really. Root canal procedures in some cases are painful, but the painful part about it is before the root canal procedure is done. Generally speaking, once the inflammation and infection, the inflammation caused by the infection, is subsided, the actual procedure is very comfortable. The living part of the tooth, the nerve, the arteries, the veins are already removed. And at that point, generally the patient's very, very comfortable. I find in my experiences that the use of antibiotics are very, very helpful at doing this.
Well, then it's a very effective process.
Oh, it's very good. It's one of the best ways that we know of saving teeth.
Well, I really do appreciate it. I'm thinking about having one, and I think you've motivated me to go ahead.
Well, thank you very much, and thanks for calling us. Well, I understand we have another call. Please go ahead.
Hello?
Yes.
Hi.
Hi, how are you? I believe we lost our phone caller. Do we have another phone caller? Well, I guess not.
Hello?
So we'll go ahead and proceed with the next part of our procedure. Now, are you still there?
Yes, uh-huh.
Oh, please go ahead.
Okay,
I'm sorry.
I'm sorry to interrupt you, but I just wonder, how much does a normal root canal cost?
Well, now, that depends. Root canal procedures run anywhere from $200 to $350. Now, that is contingent upon what type of tooth that we're talking about. A premolar or an incisor tooth, usually in this part of the country, is around $200. That is what we call UCR fees, usual and customary and reasonable fees. These are fees that are recognized by insurance companies, and this is how most of us dentists price our fees for these procedures.
Okay, well, thank you very much.
Well, thank you. Do we have any other callers?
Yes.
Please
Hello?
go ahead.
Hello?
Yes, sir.
Yes, I had a root canal, though, about 7 years ago, and they put a cap over it, and it still seems to give me problems every now and then.
Uh-huh.
And, what do you think I need to do about that?
Well, it most likely should be reevaluated, and of course I would recommend that you go back to your original dentist, the dentist that did the procedure, and explain that you're having discomfort and problems with it. Perhaps a radiograph, an x-ray would be in order, and a reevaluation of the situation, of the procedure would be necessary. And this way, we can detect, or he can detect, if there is any residual problems that might be occurring. It's reevaluation is very important in medical terms.
I see. And I have another question. I have an open-faced crown, and it seems to be rotting my tooth on the side. And seems like I can feel the nerves and, you know...
Well, crowns are very, very important to place on teeth that have had root canals. The idea is to protect the brittle tooth structure. After all, we've made an opening inside the tooth. And again, the point is to protect the tooth after you've had that valuable root canal procedure done. And I regret I wasn't able to finish this procedure, but in future episodes of Dentistry and You, we'll get to do just that. So again, thank you very much for watching my segment. And now back to Kansas City Alive.
Don't touch that dial. When we come back, you'll see what's on the next edition of Kansas City Alive.
Hey, nice try, dummies.
Take a hike, Thurston. He's no crash dummy, not a scratch on him.
Thurston's my hero.
Why is that, my little battered buddy?
Because he gets to wear the safety belt.
No wonder he's still got his original paint job.
You can't hate a dummy for being smart.
I guess so.
Here he comes.
Hey, keep up the good work, guys.
Buckle it up, Thurston.
I always do.
You could learn a lot from a dummy. Buckle your safety belt.